I will take my time and spend time with the patient. So if someone comes in to see me for a cataract evaluation or a LASIK evaluation, I don't have 4 other patients to see at that exact time. My schedule is such that that patient has got at least 30 minutes of my time. And that's how we do it, and that's how we think it should be done. So I get to know the patient, I ask the patient questions, I find out what their needs are, what their hobbies are. I even look to see how tall the patient is. Some patients have very long arms, and a lens implant that works for them may not work for someone who's shorter, who has shorter arms, who has to hold things at a different distance. So there's a lot of things that go into play to figure out what the right solution for any given patient is, but there's no way to know what that solution is without first getting to know the patient as best as you can.